My name is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, creator-thon, the Lupus Day. I want to talk about quackery in Nigeria. Of course, I will start with talking about the forces that encourage quackery and then the acts of quackery. My speech today is going to be a bit controversial. Most doctors won't like what I will be talking about. Okay, now let me start with telling you, are you aware that the greatest force encouraging quackery in Nigeria are medical doctors? Oh yeah, yes, medical doctors. Especially, that's in 93% of the cases, owners of private institutions and coordinators of semi-private, non-governmental institutions. Let me now say it like that. Owners of private institutions and CMDs of non-governmental institutions are the major culprits of quackery in Nigeria. Of course, by quackery, what we mean by quackery is where an unlicensed person is practicing a professional skill. That is, somebody who is not a professional practicing a skill that is meant for professionals. That is in the layman's language what quackery is meant to be. Okay, now let me break it down, how doctors are implicated. If you go out here, down all these streets of Kaduna now, you will discover that it is also like that in the southeast, but let me start with where I am currently. If you go down there, you will discover that pharmacies, chemist shops in the urban areas are scattered everywhere here. Then if you go to the rural communities, you'll be seeing those people who call traditional bone setters and people that remove pin. People that remove pin from people, and so on and so forth. They have so many names: native doctors, herbalists, native doctors that will now leave practice of native medicine and go into giving drip and injection. That is the kind of native doctors I mean. I mean herbalists that will now leave mborogunampa, vegetables and green leaves and now go into giving drip and juhel flagell and keftriazoam. Those are the native doctors I'm talking about, so that you do not mistake these people with the normal professional native doctors we have in Nigeria. Okay, now, when you go into, I once decided to go to investigate and find out why a pharmacy shop should have a bed inside where they give drip, where they treat wound, where they give injection, where they give they even do minor surgeries. So I went into one of the pharmacies here, and then the man was telling me that most people who come here are people who cannot afford hospitals. Mark it. Underline this statement. People who cannot afford hospitals. Okay. Now let me come down to why I said you should underline this statement. So I now ask, so how much do you charge for this particular procedure that is going on? He said if it is in the hospital, they will be charging something like 300,000. I said 300,000? Just to do I&D? He said yes now. He even mentioned 3 hospitals that this particular person has gone to, and that was what they charged her for that, the I&D. I think she was having something like breast abscess or mastitis, or whatever. So, but that she went there and they charged her 300-something-thousand. So, but the patient now came here. He did it for her. The patient bought drugs. He now charged her 20,000 naira plus the drugs he bought here, and he did it. And as I am looking at that woman, the woman is already recovering well. I said, but are you sure about this 300-something-thousand? He told me go myself and verify. I went to these hospitals. told them that, hey, I have a sister of mine that said she came here the other time, that she had a breast this thing. I don't even know whether that thing is cancer or not, but they said they were going to treat it here. And immediately I was saying it, the nurse that was sitting there told me that this is that thing is abscess. And they are going to take her to theater, do this, do that, and that before they take her to theater, she's going to deposit 150,000 deposit. So, of course, I didn't bother going to ask about the rest of the bills. I still met a similar case. I still went to another, this one is a chemist shop, where I saw the chemist man doing cesarean section. CS, the chemist man said he did auxiliary nursing in one hospital, and when he was in the hospital, he was the one assisting the doctor in doing cesarean section. So a doctor will open a hospital and leave doctors, fellow doctors that he can employ or call to come and assist him, and go and bring a male auxiliary nurse to be assisting him in cesarean section. So I want doctors to be clapping for themselves. So, because when we talk about quackery, they will be the first to say quackery. I have an experience as a youth corper where I will come into a theater when I was serving youth service. I won't mention the state. The doctor, a consultant obs and gynae, will walk me out from the theater and say I should go there. Who am I expecting to be seeing patients in the clinic when he's not around? I will go. He will call in a female auxiliary nurse to stand in there and assist him in cesarean section. That female nurse, I told you before I left that place, the female nurse was going to another small clinic and doing cesarean section, and said she, of course she's a very brilliant girl, and said she learned it from this doctor. So I want doctors to clap for themselves well, so that when next you talk about quackery, you will start with blaming yourself. When next you talk about quackery, you will start with blaming yourself. So now, number one blame I'm placing on doctors is doctors are unnecessarily overbilling patients. I'm a doctor too, so I know what I'm talking about. I know what a typical CS should cost because I do it. And I know the total cost, even with all the antibiotics you will give, the theater preparation, I know what it should not get to. In fact, as a matter of fact, no CS should be more than 200,000 in anywhere in Nigeria. I mean, even in Abuja. No CS should be. But it's a private facility, so I shouldn't be the one to dictate prices for them. But these people who bill patients, they should understand that these patients are still the normal general population who earn this mega salary. Most of them are artisans. All of them are not Ababio and Tinubu and Rocha Sokocha that are already money bags and not Eze. Majority of the patients who come to your facilities are struggling people. I'm not saying you shouldn't collect your money, but you should use your conscience and know exactly what you should bill and what you shouldn't bill. Okay, so now let me now come down. So number one point of the way doctors are encouraging quackery is by overbilling patients. Number 2 points is encouraging quacks to learn the skill in your own private facility. Number 3 points doctors are encouraging quackery is by not being ethical, unnecessarily rude, and unattentive to patients. I suffer from chronic back pain. It's been there and it's been disturbing me for a very long time. And on 2 occasions, I've personally gone to private clinics of orthopedic doctors. And I intentionally didn't tell the first person I'm a medical doctor because I was afraid that if I tell him I'm a medical doctor, he might overcharge me. I just wanted to receive a normal treatment. I went there. Of course, he worked for me. He didn't overcharge me, but he obviously didn't even listen to me. I just came in. He told me. He asked me, was there any time you wanted to leave something and you heard a pop sound? No. Do you used to stool well? Yes. And I wanted to explain further things that I was getting. He told me, please go. I've written your drugs. Next time. Of course, I didn't go there again. I went to the second one. That one was even far worse because I told that one I'm a doctor. He kept blaming me from beginning to end, kept shouting at me, kept being so impolite. At a point, I got up, I got tired, I had to leave the hospital. Where did I start going to? I started going to a physiotherapist. If I now go to a physiotherapist, she will not be the one to, after doing all those things, she will write this one and say, these are the drugs that most of the doctors I work with write. Take it, and I'll pay her and go. Because I was already disenchanted by doctors. This one, I'm a fellow doctor that they're treating like this. So the third reason why people leave healthcare for quackery is because doctors intentionally scare them away. Intentionally because of unnecessary ego. You felt you've arrived, you've built a gigantic facility, forgetting that facility has to be sustained by your clients. You will now be so rude to them that you chase away all the patients. They will not start going to quackery. You will now come here and start saying doctors and quackery are doing this, quackery are doing this. Go to dentists. Because of their ego, dental hygienists have taken over their jobs. Go and see it. Go to ophthalmologists. Because of their ego and all these things I mentioned, opticians have taken over their jobs, and yet doctors are busy forming association that will be talking about quackery. Instead of looking inwards and correcting the major problem that is coming from themselves, they will focus on this person is quackery, this one is quackery. Be doing it till they take over all the jobs. I don't talk my own finish.